Good evening, seventh graders. What we're going to look at tonight is marijuana. And when you're in class next week, first of all, anyone who has health on Thursday or Friday, please come to class when you have access, either Monday, Tuesday, or Wednesday. We're going to be watching a video and doing a short lesson on marijuana. The lesson we're doing tonight is just an overall view of what marijuana is, what the effects are, because marijuana lately has become quite controversial as more and more states are allowing people to use marijuana for medical purposes. There are some states that are moving toward letting people use it in a recreational way. And as we know, Colorado is one of those states. And so there are arguments that marijuana should be legalized because it can bring in a lot of money to the state. And, it's no more dangerous than alcohol, while other people argue that it should not be legalized and that the money that it may bring in will not be worth it. States that are legalizing it for either medical benefits or for recreational, their ability to legalize is just based in the state. Federal government has not legalized marijuana at all. So statewide, you might be legal, but federal-wise, it is still a crime. So with that in mind, what I want to point out is that marijuana comes from a plant, and it is basically dried stems and leaves from the plant cannabis. And there is a stronger form of marijuana that is called hashish or hash. And it basically looks like, it usually comes in, it's like a moist brown type or black type of cake or rolled into moist balls. And so it comes in different strengths. The other thing you have to be aware of is when people buy marijuana from a street dealer, you don't know what's being added to it. So you may think, oh, I'm just using marijuana, but in essence, it can have other things mixed in there. Usually, marijuana is most commonly smoked in a cigarette, and they're called joints or doobies. Some people actually use either pipes, especially if it's hashish. Because it's moist, it needs to go into a pipe, or a bong. And those are all paraphernalia. They're called drug paraphernalia. Paraphernalia means that it is equipment or materials used to help someone use drugs. Short-term effects. What you have to remember is that the active chemical in marijuana is called THC. And THC goes from the lungs into the bloodstream. From there, it ends up in the brain and other organs. And just like alcohol, when it goes to the brain, it affects someone's behavior. So does THC. And so the nerve cells that are affected by THC are part of perception and pleasure. And so that's how you get that high from marijuana. THC also affects the brain with thinking, memory, coordination, and concentration. And so if you look over here, there's some of the unwanted side effects, because people that use marijuana, they want to be high. They want to feel good. But they don't like other effects that just come with them. And so difficulty thinking, problems with memory, loss of coordination. And although these side effects are temporary, they can be dangerous for people that are driving under the influence. So once again, just like alcohol, using marijuana and driving is very dangerous. Marijuana also has other short-term effects, such as an increase in appetite. And you might hear someone say, oh, they have the munchies. And so that's where they're basically talking about an increase in appetite. They get tired. And once again, just like alcohol, there's a decrease in inhibitions. So things that you may not do if you were sober or straight and not under the influence of marijuana, you might do. Now, the thing about marijuana are the arguments about what happens with long-term effects. And so there are some studies that talk about changes in the brain, and someone who uses a lot of marijuana and kind of is called a pothead, or someone who uses it on a daily basis. There have been studies that link complete changes in the brain to a lot of use of marijuana. And so memory, multitasking, paying attention, these are all areas that are affected by long-term use, according to the studies. There's also fertility issues with men and women, respiratory problems. Now, this isn't something difficult to understand. Just like if you smoke cigarettes, it's bad for your lungs, and it affects your respiration and the health of your lungs, and you're more apt to get bronchitis and other lung conditions. Just like with cigarettes, of course, it's gonna be the same thing with smoking marijuana. So that's not difficult to understand. Sometimes if you notice someone who is a pothead, eventually there may not be a physical addiction with marijuana, but there is definitely an emotional reliance that people develop. And so they start to need marijuana in order to maybe face things that are difficult to them. And even though the body doesn't become addicted, the mind and the emotions do. And so they will rely on it. And they're not able to do things that other people can do without being under the influence of marijuana. So, and if you, this statement right here, if someone has a condition like schizophrenia or bipolar disorder, marijuana can sometimes make the symptoms worse. So that's important to remember. And another thing is, if you're taking medications for any kind of antidepressant or bipolar or schizophrenia, or for other conditions that someone may have, maybe asthma, whatever, definitely marijuana is going to be a problem to those people, and it's going to interact with medications. And as we said, that a lot of states may be looking at using the use of marijuana either medically or recreationally. There's still problems with the law, and the employers do not see that as a legal right to use marijuana. So a lot of places use drug testing, and so you can be fired for that. And remember that there are still criminal charges. Marijuana laws can be confusing. For example, a state might allow people to have small amounts of marijuana with a doctor's prescription, but the same state's laws make it illegal to buy, sell, or grow it. So the laws are very, very confusing also. There's a lot of discussion about the medical use of marijuana, though, and so the THC pill is sometimes available to people. So instead of smoking marijuana, you take a pill that has the potent ingredient of marijuana, and that does the same thing. Okay? So, what if I want to quit? People who use marijuana for a while can have withdrawal symptoms, and it's more emotional. They may feel irritable, anxious, depressed, have trouble eating, have trouble sleeping, that sort of thing. Marijuana withdrawal is a bit like caffeine. It's usually worse a day or two after someone uses marijuana, and then it eventually decreases. But it's still something that you're going to feel the difference once you quit using something that you're reliant on. You're always going to feel an effect, and that's the same thing with marijuana. So basically, it just takes you staying away from the substance to get your body used to not having it there. But there are people that become so emotionally and psychologically addicted that they still go to rehab because their reliance on marijuana to do everyday normal activities that you would do easily, being sober, being straight, they cannot do. So they have to go to rehab. And the other thing is that you have to understand is that drugs and alcohol, there's a reason why people use them. And it's not it can be because of peer pressure, like we've talked about. It can be because there's family issues. But whatever the issue is that's underneath has to be dealt with if people are going to stop using drugs and alcohol. And so as a result, people sometimes really have a hard time quitting. So be aware of that. And also, there's the gateway drug theory. And so people believe that marijuana is a gateway drug. It's the start of something more serious. So people that pick up a joint at a party because their friends are doing it may become dependent on it, and then they look for something that's even a bigger high. So they may move to crack cocaine. They may move to methamphetamines. They may start using pills, and eventually end up with a very serious drug, and that's heroin. And heroin has caused many deaths. First of all, because of people overdosing, but also because of what I talked about earlier with marijuana. Dealers and people that sell drugs sometimes add things to make those drugs more potent, to give you a bigger high. And those things can kill you. And a lot of times they want to make money. And just like we talked about proof and how proof came along with alcohol, and people were watering down the alcohol. So there was, they would buy a gallon of alcohol, they would add water to it, or they would add something else, and it became, 2 gallons, so they could make more money. Well, it's the same thing with drug dealers. So whether you're talking about marijuana or cocaine or heroin, any of those drugs have things added to them, and you don't know what they are, and you don't know how dangerous they are. So what I want you to do is there's a link on right below this link to Nearpod, and I want you to go on to Nearpod. I will list the code for Nearpod that you have to punch in. Remember, you don't log in. You just simply add the code. The code will be listed in this assignment. And I want you to answer just a couple of questions that I have posted on Nearpod. And with that, have a good day.